I was personally impressed with your, I think it was the blog post about your life and how I would read a paragraph and then have you just give your impressions, thoughts about then, how you were feeling then, thoughts as you reflect on where you were. And then we'll just go paragraph by paragraph by paragraph, and then we'll end with you talking about what you're doing now.
Sure, absolutely. That end part, I think, is just so my heart song is doing somatic based work, but my whole life builds on that. And
Absolutely. Absolutely.
my true hope, my hope someday, since you're a doctor, is that doctors learn these tools.
Mm.
That's my true hope, is they understand that when they have a patient in their room that's experienced grief or trauma, right? Or even anxiety or depression, there are ways to work with that. 100% I'm in support of Western medicine and psychopharmacology. I want to make sure you know that. But there's so much more out there that we can include. So I just want to make sure um, that's one of
Absolutely.
my missions and
Absolutely.
visions.
Your story was so well written and so impactful that I kind of wanted to share it with everybody.
Sure.
Okay?
Yeah, 100% okay. Everything that's on there is 100% okay.
Okay.
Yep.
So, welcome to Black Women's Health Podcast, a podcast that's really dedicated to promoting health and healing for Black women because of racial healthcare disparities and all the things that we know to be true. But we always recognize when there's someone, irrespective of race, who comes with a powerful story. And that's the way I see you. And so, welcome.
Thank you.
Read a section, and then I'm going to ask you to respond. Okay?
Sure.
Okay, let's get
Sounds good.
started. From Amy's blog post, it says, "Hello. My name is Amy Pickett Williams. I have been a licensed clinical social worker for 25 years. Happy
Mhm.
anniversary to me. I am also a yoga teacher and specialize in somatic, meaning mind, body, spirit connection therapy. 26 years ago, I was recovering from extensive surgery. While I did not have cancer, I was put on an oncology floor as that was where the beds were available. My week stay brought joy to the nurses as I was a healthy young woman and I was full of humor. They encouraged the oncology social worker to visit someone who was not sick or dying. She came to visit me, and I felt such a sense of beauty in her being and what her life path truly was. In our conversation, I asked if she would want an intern next year. She agreed, and that was the start of my humbling career. So
Yes.
tell me a little bit about this young woman and where she was. What do you remember of her?
The oncology social worker or
Yeah.
myself?
Or both.
Yes.
Yeah.
So the oncology social worker, she was actually probably she is about 30 years older than me. So she had done this work for many, many, many years. Um, always been in a hospital or a clinic. And I had no thoughts of, to be honest with you, ever going into this field. I had thought I wanted to be an attorney, which is what my dad was. And so I was just awestruck, one, by the nurses and how caring and compassionate they were. And two, getting to meet this woman named Janie who had done this work for 30 years. And when she came into my room, we just started conversing and talking about, what she'd done in her life. And I was awestruck, to be honest. And I thought, wow, you can really meet people in such an intimate and humble way when you're working with someone that's told they may die. And it was a profound conversation with her. And by the end of the conversation, I said, Janie, do you want an intern next year? And she said, oh my goodness, Amy, I haven't had an intern in decades. And I said, I would be so honored to be able to learn from you. And by the end of our conversation, she said, next fall, let's do it. So my last year of grad school, I started interning with her and learning the whole system of what it was like to be in oncology and bone marrow transplant.
So, what exactly does an oncology social worker do?
Yeah, it's a good question. So a lot of times social workers and case managers and hospitals help with like discharge planning and making sure people have safe places to go. But oncology is really unique in the sense that the social workers don't tend to do the case management piece. They tend to work with patients through the process. So sometimes it could be, they're diagnosed with cancer and the field I started out in was adults, although later you'll hear I switched to children. But at that time, sometimes it's the crisis management of, I don't know how I'm going to pay my bills.
Hmm.
But then it goes a lot even deeper besides that crisis management of how am I going to care for my kids or how am I going to make sure my dog is okay while I'm here for this long period of time. And then it goes to that place of, I'm really scared. And so you spend a lot of time working with them around those emotions and feelings of being very, very scared and going through the process of either potentially going into remission or facing the fact that they will die and what that looks like practically and also mentally, emotionally, physically, and spiritually.
It sounds emotionally draining.
Yeah, I think you also learn, the good news is you learn in grad school and on the job how to care for yourself during that time and that you can be 100% with someone in that moment and then you can you can step away. And you learn that over the years, but there's obviously some stories, I'm sure for you as well as a physician that will always stick with you.
Mhm.
But I think those are the stories that shape us.
Okay. After meeting her, you had decided on a career change, or you were just interested to see what her world was like?
I think my heart said it was, this is what I want to do. And the
Okay.
one part I didn't share in the blog was from there, I actually did think about going to medical school in my second year of grad school.
Yes.
And because I wanted to be present with people in that. And I gotta tell you, organic chemistry almost killed me because I had to do prereqs. And I thought, okay, let me think a little harder about this one.
Okay, let's keep going because this story gets better. The next year, 1998, 1999, I would intern in the bone marrow transplant unit. At that time, doctors were transplanting many types of cancer. It was a relatively new procedure. We did see some success, but a lot of deaths occurred. My first patient was a man in his 40s. He had been a motorcycle rider for many years. He was big, full of tattoos, and had a very different life experiences than I did. He decided that he would be my teacher. I would learn about his emotions, his traumas, his bone marrow transplant, physical symptoms, and all that came with it. I sat with him as he would vomit. I would step out when he had extreme diarrhea and held space as this strong man would share his fears and tears.
Yeah, he was a profound human being. And my guess is he'd never had someone to teach to based on the stories he shared with me. And so he found it such an honor to be able to do that. And as I was a student at the time, I chose to allow him to truly be my teacher. And in that work, I was able to utilize my skills in counseling him, but we never saw that role. We never put that role on each other. He was truly my guide. And
Mm.
that's where I learned what it was like to go through at that time a pretty horrific medical procedure.
Are you talking
And
about the bone marrow transplant?
yeah, yeah, the really intense chemotherapy, the all the different things that come with it. And he would be open and honest with me about everything. And I learned how to sit with that and hold that space and understand that at times, there are no words when someone's going through that, but to be able to sit humbly with him to learn from him. And I, once again, was so, in many ways, awestruck by his courage and his strength and his ability to tell me his story, not only the cancer story, but just his life story. Um, and it was a profound gift.
Are you able to explain a bone marrow transplant to those that may not be aware exactly of what it entails?
Yeah. So when you have different, I mean, obviously we don't transplant all different types of cancer now. It's definitely changed quite a bit over the years. But at the time, the goal was to give such blasts of chemotherapy to where it would kill all the cancer cells, but it would also kill pretty much all different cells in your body, including healthy cells. And
Yes.
so sometimes they would get an auto transplant, which was their own stem cells. They would take them out, kind of below their spinal cord area and transplant it back. But then sometimes they would try to get someone else's cells. And if you didn't have a perfect match, which most of the time there weren't, there would end up being a lot of complications. And people would end up, there was something called graft versus host disease, where the new cells would attack other parts of the body, any living cells in the body, and people would get very, 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 very sick. And because the cells from the transplant sometimes would take and it would be successful and they would rebuild their immune systems, but sometimes they would not. And so they would die from a lot of times infection because all their healthy cells were killed too from the chemotherapy.
That's right. And this is a process. This isn't an in and out procedure.
Oh,
Often you're in the hospital for days. You're actually given medication, like you said, to kill the cancer cells, which also in the process kill healthy cells. So you are essentially depleted with the
mhm.
hopes that the transplanted cells will take. Yeah, it's quite a
Yes,
process.
yes. And at that time, I mean, people were in the hospital sometimes for months when I was working with them. And so he was, for the most part, in the hospital during my 9 months of that internship,
Wow.
once in a while getting to go home. But for the most part, he was there.
Wow.
Mhm.
And so he was a teacher. You had two teachers, first the social worker and now the
Hmm.
actual a patient. Okay.
Yes.
All right.
Yes.
Let's continue. Our journey together sadly completed just before I graduated. He died from complications of his transplant. His last words to me after I expressed my gratitude for being his student was, I wish I had more time to teach you. His words helped guide me to continue the journey of learning and working with the sick, the dying, and the bereaved. I believe it was the most intimate and humbling of all journeys in this life. So you're saying that end of life journey in your mind
Mhm.
is the most intimate and the most humbling?
I believe it is. And sometimes I'll even say to people that I think it's more intimate than sex. And the reason why I say that is because you're getting into someone's most vulnerable time of their life to know their life is ending. And you have this ability and this gift to be present with someone during that time where it's the most raw. And so it's such an honor when you work with someone that is dying.
Have you heard of the term death doula?
I have.
Do
Yes, it's
you
becoming a newer field.
do you consider
Yeah.
yourself a death doula? Or do you consider this the work of a death doula?
Yes, I would say it definitely is the work of a death doula. I wouldn't consider myself a death doula, but I've been able to be present with people during those experiences. And so I think it's an incredible, beautiful work. And I love that the field is growing quite exponentially, that we're being able to honor that. Hospice was a more common thing in other parts of the world, and hospice became something important in our country, about for 30, 40 years ago. And now we're recognizing we need to even do more work around this, not only for the person dying, but also the person that is grieving the death or the loss as well.
Hmm. Do you think it's more for the person that's dying or more for the person that's grieving the death? Or can you even say?
I don't think I can say, to be honest. They're different. They're different. And they're very different grieving processes. Elizabeth Kubler-Ross, who everyone has heard of, The Stages of Grief. I have such gratitude for her because she studied something and brought out to the surface so much that we had not looked at before. And now what we recognize, though, is that Elizabeth Kubler-Ross did her work on the terminally ill patient, and
Mhm.
that terminally ill patients went through, for the most part, certain stages, but we know those stages are not applicable to those that are the bereaved. And so I think that's the part that's so important to note is that, I mean, I have such honor for her, as a human being to brought this to the surface, but it was only one part. It was the person dying, not the after effects of the people that experience it, the loss after, or the loss of other things as well, too.
That's interesting because you're right. To a large extent, we don't really consider the process of the people who remain after their loved one has passed on and the grieving and the different stages or the work that they have to go through in order to, I don't know if the right word is heal or to be able to keep going.
Yeah, and I actually, I'm glad you brought that word up. I don't really believe we heal from grief, but we can grow around our grief.
Okay, that's a good word.
Mhm.
That's a good word. Okay, to continue with your story. The next years would take me to working with people who are homeless and providing hospice care, working with children experiencing medically complex challenges, children who had burned, some by their caregivers, children with cancer and other blood disorders. I sat with children and teens as they learned of their diagnosis. That must be an interesting process. Sat with their parents and siblings as they process fears and hopes. I held space for children experiencing death and the families who mourn the most intense pain a parent could ever feel. Later, I would continue this journey in private practice. So you've moved beyond oncology and
Mhm.
bone marrow transplant. Why the shift, or how did that come about?
Yeah, good question. I will say part of it is that it is a very, very hard field to be in, and it does start to take a toll. And what I learned in that work was that it wasn't just about death. When you read the part about different blood disorders, I worked with many families who have experienced just sickle cell. And while many of those kids don't end up dying, they experience extraordinary pain when they have a flare up, right? And families experience a lot of loss in regards to not being able to do the things they maybe hoped they had. For example, in Denver, we're at fairly high altitude, and so a lot of these kiddos would struggle with our altitude, but these kids wouldn't be able to go up like skiing in the mountains because it could trigger a flare up. And so I started recognizing, and in some of these families as well, all families, whether it was sickle cell or other blood disorders or other diagnoses, there was other loss that they were experiencing. right? Like I talked about at the beginning, there's lots, sometimes you lose your home because our insurance system is so awful in our country and families couldn't afford their treatment. And so there was loss of their home or loss of finances. And then I started realizing, and parents were struggling with their identities, right? That they, some of them were working really hard and then all of a sudden their children would get sick and they were no longer could have their profession. And so there was a loss of identity. And so it started morphing into realizing there's so much loss we can work with in this world. Doesn't need to be just the cancer part of it. Excuse me, I'm a little bit tickled, a little bit of a cough.
Mhm.
And so I started falling in love with the idea of knowing that I could work with people that have experienced all different types of loss, including, infertility and loss of just health in general, loss of independence, loss of self, families who experience divorce, loss of relationship, and realizing that some of the tools that I was starting to build early in my career and continuing to be could be tools that could be utilized for all different types of loss.
Yeah, it's more like life not living up to your expectation and
Yes.
dealing with the gap, the gap between what I expected to be true for me and my reality. And how do I
Mhm.
bridge the two? Yeah,
Yes.
yeah. And so
Mhm.
how long were you involved with this type of work before you actually went into private practice?
Yeah, so I stayed at Children's for a number of years. I want to say about 7 years. And then I worked in community mental health where I also began to understand all those different types of losses that I just listed.
Hmm.
And in between all of that, I also started a small private practice. So the private practice started in around 2006, I think. And then gradually as I had my own human children, I had pets, but I hadn't had my own human children, I decided to move just into private practice so I could also be available more to them.
Okay, let us continue. My heart song is still working with grief. And as I learned over the many years of doing this, grief, just as you said, is not just about the death of a human or a pet. It's about the loss of a relationship through separation or divorce. It is about the loss of health or independence. It is about the loss of employment or housing or financial change. It is about infertility. It is about becoming a parent or an empty nester. Interesting. Or losing the sense of a previous identity. It is about mental health diagnosis such as depression or anxiety or PTSD or temporarily grieving the loss of feeling at peace. It is about terrorism or war or losing any sense of safety. Now, my work with clients is not only about holding space for those who grieve from death, but all the other ways we grieve. Grief is a collective experience. No one is immune from it. And I guess that one sentence needs to be underlined. It's a common experience.
Yes, it is.
You've just opened the door to everything. You mentioned empty nester, which we don't, wouldn't necessarily put in the same category as grieving the loss of a loved one, a parent, but I suppose it's again the loss of a relationship
Mhm.
and how you manage that. And when you're doing this counseling, is it just for one person or is it for the two involved parties or all the involved persons?
Yeah, it's another great question. It can be anywhere from just the person that's coming in that says, I've experienced this. I'll give you another example that maybe you wouldn't think of normally in loss. I see a lot of postpartum moms and they come in and a lot of times they're struggling with a lot of anxiety or depression. But there's also this piece similar to empty nesters and that their life is fully changed. They're so excited that they have this new baby, but in the same breath, they miss their old self,
Mhm.
right? Similar to the empty nest piece, I'll have people come in and they'll say, I'm so excited I've launched my child and my child's in college now, or my child has a job, or I'm becoming a grandparent. And I also really, really miss being with them, right? It's holding both.
So what steps do you take a person through if she's that postpartum mom or that empty nester? What do you do with
Yeah,
that person?
great question. So first, want to honor that, right? And hold that space for them, like I did for the people and have for people that are dying, of saying, yes, it's okay that you're feeling such a paradox, right? Of feelings. And so holding that and knowing that that's normal for them to have that. And then because I'm a somatic therapist in many forms, I mean, I've been trained in many different types of therapy, but I hold strongly in my heart somatic. We talk more about what does that feel like in their bodies? And a lot of times they'll say, I feel this hole in my chest or my heart, or my stomach is in knots and I don't understand. I've gone to my doctor and my doctor says there's nothing physically wrong, but
Mm.
it feels like there's something wrong. And so we start there and we learn what that feels like in their bodies.
So you acknowledge the fact that they feel as though something's wrong.
Hmm. Hmm.
Okay. So how do we heal?
Good question. So the next piece is once we recognize that we're feeling these symptoms in our body, I then talk with them a little bit about the science of grief and that we know that there's they've done functional MRIs of our brain and that multiple parts of our brain light up when we're experiencing loss. And then we also know that we experience loss in our bodies. I can never pronounce this correctly, but there's a Japanese study about broken heart syndrome, and it's Takitsubo, I think is what it's called. And there's a lot of evidence-based research that when a partner or a spouse dies, you're twice as likely to have a heart attack. And so letting people know that it's normal to feel these physical symptoms in their body and our cortisol levels can really increase, excuse me, when we experience intense trauma or grief. Excuse me. And so if we're feeling it in our body and we're not acknowledging it in our body, we need to work with our body in order to potentially decrease the intensity of the symptoms in our body. The way we do that, excuse me, the way we do that, there's three ways. Well, there's more than three, but I'm going to give three. One is recognizing that we have these, and when we are really struggling, we contract in. And so if we can do some expansion of heart opener, opening up our arms and our chest, expanding, and then contracting in, and the pendulating. When we open up, we allow our vulnerability to share what's going on. And then when we contract in, we tell ourselves, excuse me, I need to be able to contract within right now. I'm so sorry. Grab a little cough drop. Another way we can do it is through the vagus nerve. Dr. Stephen Porges came up with something called polyvagal theory. What we know is the vagus nerve is our 10th cranial nerve, and it's a bidirectional highway, and it wanders from our brainstem all the way down to our lower torso. It goes both ways. The messages go both ways. If we can recognize that it goes both ways, then we can recognize we have to work with our body. The interesting thing about the vagus nerve, though, is that it communicates 80% body to brain, 20% brain to body.
Hmm.
So while talking holds merit, it's really only 20% of our work that we do. So if we can stimulate the vagus nerve, it can help us get into that calming response. I'm going to talk a little bit about the calming response. Dr. Daniel Siegel talked about the window of tolerance. And that's our place when we're calm, when our thinking brain is working. And so doing these different exercises, like stimulating the vagus nerve, and I'll give some examples in just a minute. What we can do is we can learn how to get back into our window where we can concentrate and focus and be in a peaceful place. So when I am experiencing grief, or you're experiencing grief, most of the time we're not in our window. We're in this place above our window where we want to fight it and we're anxious and we're scared and we're overwhelmed, or we go below our window where we're almost in that dissociative state. I don't want to get out of bed. I'm immobile. It's too much. And so when I'm working with clients, I'll first assess like how big is that window? You know, when they come in, sometimes their windows are about the size of a dollhouse window. They are outside of it all the time because of the loss or trauma they've experienced. And so when we experience such intense grief, we are going out above it and below it all the time. So part of the work with stimulating the vagus nerve, which I'll show and talk about if you'd like for a few tools, is how to get back into the window. But just as importantly, how do we expand our window so that it can be the size of a sliding glass door where we're riding the roller coaster, but we're still in our window. And so if we can stimulate the vagus nerve, which is done through breathing exercises, a longer exhale. So breathing in slowly and out even slower. One way to do that is through straw breath. Another way to do that is through vibration. So humming, singing. Even if you place your hand on your throat and start humming, you can feel that vibration. And that helps us with allowing the stimulating of our vagus nerve to get us into that calming place. We call that parasympathetic response.
And can you feel a difference when you're in that space?
Yes, yes, you can. Excuse me.
Do you need to get any water?
To do a cough drop and a little water. And I apologize.
No, no, take your time. Someone might say, why not just get an antidepressant? Why not take medicine to help you deal with your grief? And what are your thoughts about that?
Yeah. So sometimes medication is necessary, and I will never diss that. Sometimes every emotion we feel with grief is normal. Sometimes, though, the emotions can get so intense. We can go outside that window, especially below the window, where it's Dr. Stephen Porges calls it the dorsal phase. That's that immobile stage. And sometimes I get clients that say, I just can't live anymore. I want to be with the person that died. I want to be with my partner. I want to be with my child. I've experienced too much. Sometimes we need some medication to help us just take the edge off in order to help us with those tools. Sometimes, though, we don't need the medication. Sometimes it's learning how to ride that roller coaster and learning these tools to help us get inside that window of tolerance once again.
Is there a time limit? Meaning that if I'm trying to stimulate my vagus nerve and I've been doing this for weeks, does there come a time and point where you might say, or I may feel, I need to try something else? Meaning that if I don't see a result within a certain period of time, then I should move on to another type of therapy.
Yeah, and stimulating the vagus nerve is one, right? The other things is bilateral stimulation. So intentional walking, using both sides of the body, both sides of the brain can be really helpful. Swimming, hiking, um, knitting, painting, drawing, anything that's body based can help us with our grief.
Hmm, interesting.
Yeah, yeah. So it's not just the vagus nerve. I'm sorry, I had a little coughing attack, so I didn't get to finish, but that's the other piece that we can do as well. And yes, I mean, I'm a psychotherapist, so I'm going to say, yes, find a therapist too. Maybe find a therapist that specializes in somatics. I'm going to be biased towards that because I believe that can be really helpful.
Okay.
Find a grief group, a support group, and talk to your doctor if you need some medication. Find a psychiatrist. It's okay to do that. Spiritual as well. Almost every grief client I work with, spirituality comes up, no matter what their belief system is.
Mm-hmm.
And so, one interesting thing about the spiritual piece of it is they almost all spiritual backgrounds use somatics.
Mm.
And you may say, what do you mean? Well, when we sing, we're utilizing somatics, we're utilizing our body. Or when we chant, or if we have rosary beads, or we have mala beads, and we move them, that's a somatic experience. And so standing up, sitting down,
It,
praying,
it's
contracting in.
it's interesting because I do think that when we are grieving, that we tend to go inward and we isolate and we sit in a dark corner. And what I'm hearing you say, we should be doing just the opposite. We should be breathing. We should be engaging in activity. We should be in community with other people. And all of that helps us deal with our grief.
Yes. And it's okay to pendulate back and forth too, right? Because there's times where we do need to withdraw in. But
Hmm.
there's also then that same breath in that inhale, we expose ourselves to saying, I need help. And
Hmm.
in that exhale, we would maybe withdraw in a bit, right? And so it's that pendulating back and forth that's part of the work of growing with our grief.
Okay. But your story continues. All right.
Yes.
We all learn from our experiences. My life, like all of yours, has experienced many twists and turns. A few years ago, I wrote a piece about how yoga had greatly changed my life. I compared my life to the great cactus,
Uh-huh.
Zorro cactus. For years, the arms of my cactus were very straight, almost cross-like, one experience done and on to the next. As I healed and integrated my experiences, my arms would flow like a vinyasa yoga class, slowly moving arms towards each other, almost like a hug. I was learning the integration of all paths lead to a journey of wholeness and new beginnings. COVID then challenged our world. Our youngest son had some serious health issues, so we stayed isolated longer than most. My parents were incredible supports and helped with homeschooling our three boys during this time, as both my husband and I continued to work. So, it's talking about life and changes, expected and unexpected.
Mhm.
Right.
Yes.
Now, this analogy with the cactus, if you would explain that a little bit more.
Sure. I think so much of the time I've seen this my own personal life and professionally and with friends and family. There's times where we literally stand straight, protected. We have spines around us because we're scared to allow that vulnerability in. We're scared to share our stories. We're scared to accept help. And so, I'm like everybody else. We have times in our life where we're like that. And so for me, for yoga, was what really helped um, allow myself to open up a bit more. Obviously, in sharing this story is a big, big thing for me. I would never have done this in the past. And
Mm.
yet I recognize that what has shaped me is my stories, just as it has for all my clients and everybody that I've ever met in my life. And so I compared it to the cactus in the piece that I wrote years ago. The last little part was, and then finally the bird perches on the flower on the top of the saguaro cactus, freely singing her song. And
Mm.
so it's allowing to say, yes, come sit with me, come be with me.
Okay, that's beautiful. All right, to continue, on October 13th, 2020, our lives forever changed. We had been camping with my parents as it was one activity we could safely do as a family. My parents were returning to their RV. It was a very windy day. My dad went to close the gate of the RV storage facility, and a gust of wind pushed the gate so intensely that my dad fell onto his head. For 2 days, he was on life support. We learned that he was brain dead and we withdrew the support. For the next year plus, life was about caring for 3 children, my mom, my clients, and my own grief. Fortunately, my husband and friends held space and cared for me. What strikes me about this paragraph is literally out of the blue, something random happens
Mhm.
and profoundly changes your life.
Yeah, it was a profound moment. And while I had experienced professionally moments like this, and I'd experienced personal things in my life, but nothing that was such so immediate, so urgent, and so unexpected.
And clearly, you are practicing what you preach because that must have been something very hard to share.
Yeah.
All right. My dad was an incredible human being. He was an education lawyer and spoke nationally on mandated reporting, preventing school violence, protecting children, including transgender youth needing a safe place to use school restrooms. For many years, he would encourage me to teach about my experiences of working with sick and dying children and their families. I would always decline, as I was more of an introvert and loved the individualized support I offered my therapy clients. Once again, however, my life had another twist on its journey.
Mhm. Yep.
And I would say, how could you possibly be an introvert and share a story like this?
I think grief changes you.
For the better.
Hmm.
Here we go. On my 47th birthday, my husband and I were hiking just outside of Ojo Caliente. It was a beautiful hike, and at the top of the mesa was an old mica mine. As we walked, there was the crunch of what felt like shimmering diamonds under our feet. On our way down, there were several steep sections, one of which had a juniper tree jutting out of the loose rocks. I held on to the juniper tree and thanked it for its support, giving it a gentle hug and commenting to my husband how much it had likely supported others down this steep trail. Fast forward to the end of the hike, another steep part. My husband suggested that he take the lead, as he had been a mountaineer all his life, and I had struggled with balance as my feet and legs were not formed correctly. My stubborn, airy self expressed it was my birthday and I was going to lead. I slowly took some steps down, but the loose rocks caused me to slide. I slipped and tumbled down an embankment, somersaulting over prickly pear cactus, sharp rocks, and impacted dirt. I fell over 40 feet. I do not remember much about the fall except when my head crashed into a rock and saying to myself, that's not good. As my dad had died from a fall hitting his head, my body was punctured with over 600 cactus vines. I had severe concussion, fractured tibia, lots of deep bruising. I did not die. And all I can say, this paragraph, I think when I first read this is the part where I think I just paused a moment to try to imagine and picture this happening to you and thinking, oh my goodness, so random on her birthday.
Yeah, very random, very unexpected, and once again, very profound on many levels.
Yeah. It's life. It's kind of what life will do to you.
Mhm.
Um, the unexpected things that happen along the way. But then you
Mhm.
go on. You say, do you know what saved my life? I would have fallen another 60 feet and surely died had but another lone juniper tree stopped my fall. Such beauty and the sacred interconnectedness of life. We raced to the hospital. The good news is I did not have a brain bleed, so I would not follow in my dad's footsteps. After multiple hours, they discharged me. My husband went to get the car, and while I was waiting, I fully passed out in the emergency waiting room with my poor husband witnessing this. My eyes were fully dilated and I was unresponsive. Now, 2 times in a day, he thought I had died. They readmitted me to the hospital, this time imaging my belly to ensure that I did not have internal bleeding. Fortunately, I did not, but instead, a mass was found in my belly.
Mhm.
I cannot imagine this day.
It's hard, it's hard to fully embrace that day. There was a lot of trauma.
I would imagine just hearing this story makes you feel some of the emotions that went along with that moment.
Yeah, for sure. It's interesting having someone read. I've never had anyone read me the story. So it's an interesting, I'm definitely feeling a lot of feelings right now.
How
In
long
some
ago?
ways, what?
When did this, how long ago was this? When did this
A year
happen?
and a half. It was
I-
March 2023.
oh,
Hmm.
oh my.
Yeah.
All right. And so, and you go on. So
Hmm.
at this point, I am totally mesmerized by this story. It's
Hmm.
like, what could possibly happen now? And you say, long story short, I had cancer.
Hmm.
I underwent surgery and feel so much better now. Can you believe it? The juniper tree saved my life twice. I will revisit my writing of the Saint Kalpa. I'm not sure what that.
Sankalpa.
Yeah.
Yeah, Sankalpa means integration, finding what it, or it means it's setting an intention. I'm sorry, it means intention. And Sankalpa is my intention was integration. How do I integrate this? It's
All
a
the things
yoga
that
term.
had happened, putting it all to make sense of it all.
Correct. Because
Okay.
that's part of what I've learned as years as a grief therapist. How do we integrate to find meaning and purpose?
Isn't life so mysterious? It is the continued integration of all paths and all parts. The words of my dad have returned to me over the past few months as I have healed and continue to integrate my journey. Over the past couple of months, I have truly felt my dad's presence. I believe the acronym LIGHT, LIGHT, love in grief held together, came from him. Love always. is in our grief, and held together explains that connection of love and grief. And we have to hold space and support for all people experiencing grief. I believe he reminded me of the courage and strength I have always had. And now I will speak of the lessons learned. A little bit more about love and grief, if you can.
Yeah. Anytime we experience loss of something very important to us, we have a love for it. Maybe it's a strong attachment. Maybe we didn't love some things, but it's a very strong attachment. And so when we lose that, we grieve. And then the held together part, again, fits with love and grief do come together. When we have a strong attachment, a strong care, a strong love, we experience loss. And then we have to hold each other, which led to the four goals of what we do now in our nonprofit.
And which are the four goals?
They are remind people they are not alone in their grief, to teach somatic-based tools, mind, body, and for some, mind, body, spirit, or soul-based tools to support integration and finding meaning. It's important for me to say here, though, we don't say in our nonprofit that things happen for a reason. Some people believe that in their religious backgrounds. That's not what we're saying. What we're saying, though, is how do we find meaning afterwards? What can we do with it? For me, it was starting this nonprofit. For you, it may have been your work in all these years as a physician. For me, it was also in the past doing what I did as a social worker, right? For some, it might be saying, I'm going to go work at an animal shelter or a homeless shelter or be a teacher. So part of that, so second goal, again, learning these tools to support integrating our experiences to find purpose. Third goal, connect with other resources to support people in their grief and their loss. Right now, you and I are doing that in this podcast, right? To help other people. And the fourth one, stand in solidarity for all people and all types of loss. This is significant. What started off our nonprofit, at the time, it was not a nonprofit. We just became one, but was to hold a solstice event. And in September, just this last year, exactly a year ago, I got a group of volunteers together to do an event where I taught somatic-based tools and the science of grief. And then we brought faith representatives from every possible background we could find. September is significant because we planned this, and it was soon after the horror of Israel and Gaza. And the beauty of all this is we had rabbis, we had Muslim representatives, we had Native Americans, Christians, Catholic, Buddhists. We invited as many different groups together. And we held this beautiful event on the solstice where we had about 200 people in person and over 500 virtually. And we held this event to stand in solidarity. After that event, which I believe my dad led me to do, my dad, 2 weeks later, so mid-January, said, Amy, your work's not done. And so a group of volunteers, we put together this nonprofit. And in this nonprofit, we'll continue our solstice event. We have trainings to teach somatic-based tools, including continuing ed credits for mental health providers and nursing. My hope is to get doctors someday.
Mm-hmm.
And we also have classes that are all donation based, so you don't have to pay because there's not enough mental health providers right now in this world. And so if we can at least give help with some tools, right now we have a yoga and a sketching class. Our goal is to build dance and other forms of art and singing. And our goal is to have pockets of light everywhere. And so, and we also have a social,
Why do we need these pockets of light? What
because we
purpose
need
do
to
they
work with.
serve?
Good question. You have great questions today, by the way. We need to be able to integrate our grief in order to work with growing our own selves and then work towards healing our grieving world.
Hmm.
We need pockets of light to learn these tools, to work with our grief, and then take that next step towards helping other living beings in this world.
Yeah, so this is such a powerful story. And there's such irony in the story. It's that terrible fall probably saved your life, in that had you not fallen and gone to the hospital and then passed out, they would have never done the imaging, probably would not have been done for a while, and they would not have detected the cancer. And then
Correct.
as a result of that, would mind-boggling, mind-expanding day on that birthday, it just opened you up to be receptive to the messaging from your father.
Yes.
So it's something that sounds horrific was also wonderful and beautiful at the same time, if you can
Yes.
imagine it.
Yes. And in my work in all this years, it's about holding both,
Yeah,
right?
yeah, it's holding both. It was a
Mhm.
terrible, terrible day, but
Mhm.
the consequences of that day have been beautiful.
Yes. Yes. And that's my hope for everyone else in this world is they can hold both and they can learn these tools and then maybe find their purpose and their meaning.
Mm. This is the culmination of what I have learned from my clients, my experiences in life, including being a student and teacher of yoga. All of this encompasses our understanding of mind-body connection. I hope you will take away lessons of your own healing and learn how to integrate the somatic mind-body-spirit connection to your life. Thank you for taking the time to read this. And I have to say, I continue to be profoundly affected by your story, and thank you for sharing.
Thank you. It's an honor to be here. Thank you.
So if someone wanted to find out more or be in touch with you, tell us how would that person go about doing so?
Yeah, our website, which is Light, Light, MVMT.com. So M is in Mary, V is in Victor, M is in Mary, T is in Tom.com. Um, you can also spell out lightmovement.org. Now that we're a nonprofit, we have that, but it will revert back to our page. And you can look up all the information. You can, in the next month or so, we'll be building a virtual platform for people all over the world, country and world, to tune into classes. We have a big training in October that we hope to get a lot of people there, including continuing ed credits for certain professionals. And we have a grief retreat in Colorado in November that people are welcome to come to. It's in the beautiful Black Forest outside Colorado Springs. And we and our obviously our solstice event, which we hope we triple in numbers virtually, to bring people together. And so, like I said, many of our things are free or donation based. And if people have the ability to donate a little bit, we just got hit with a $13,000 insurance bill because we're a nonprofit and we're all volunteers. So we're always looking for people if they're open to donations, would be really helpful. And we hope to make a difference. And if there's people that want to take our training and that know somatics and want to offer a workshop in their place of living, like let's say where you live or somewhere else, we hope they do. And whether we can link it to our website or not, our mission is really just to teach these tools to support others.
That's fantastic. And let's end with, if you had to give advice to someone that's experienced a recent loss,
Mhm.
who is, going about their day to day, but still struggling, what would you say?
First of all, I'm pausing because there are no words truly, right? But what I would say to them is, I know this is hard. And I would say to them, take the time Allow yourself to feel the feelings and know that there is support out there and you are not alone.
Mhm,
You are not alone.
mhm. Thank you so very much. I really enjoyed speaking with you.
I really enjoyed this too. Thank you.